everyone to this episode of your Freedom Hubs Working Group. I'm your host, Jeff Cantor, along with Charles Froman. We are definitely sponsored by the Marketplace for Health, Wealth, and Freedom, and we're excited to have you take a look at that and also find out about it being the Disruptors intersection. To that note, we are also running a concurrent program on the evenings in the same vein, and so we'd certainly encourage you to participate in these. And as I said, we are as a part of that last website. Now, there's two ways to get there. Both of these websites take you to the exact same place. But as a quick detour, and even prior to getting to there, let's take a quick peek at something that we've just uncovered, because a lot of people are very upset about the idea of having used Google, Chrome, and all these other browsers that are paying attention more to you than anything else. This is one that's come out that's completely anonymous, and it even forewarns you when things are happening. I even went to a bank website and it indicated that it was blocking motion detection technology that the site was trying to use on me. So be aware, this is a little toy out there that you can start to play with. But if we take a jump over to the website, here's where you land. There's a lot of good drop downs and things to look at over here, informational throughout. When you're at the webinar site, which is here, we'll come back to, but you'll notice under the home, there's webinars, but then continuing the conversation. That in many ways is the most important part about what's happening, because after you've had a chance to meet the guests, you want to maybe connect with them after the fact and start to learn more about what they're doing and actually become actively involved. And so here's your chance to really help this thing go. So today's webinar represents a beginning, not a once and done kind of a thing. And then the other biggie is this Freedom tab, Fighting for Freedom. Over here, this is where we collect all the different issues and things that are happening. You need to really click on all these to help take action. And then down here, different organizations that are fighting for freedom collectively that you may not be aware of. And this keeps growing all the time. So we'll want to bring more and more of you into the fold. So let's take a look at today. And before we actually get into the guest of the day, on the webinar page, there's a little bit about it. There's a description of the two ones for the current day. And then down here below is a little breakout of the ones that are coming up, so you can plan in your calendar. And then very importantly, here near the bottom, these are the links where all these videos appear every Monday. There's a new video on all four of these channels. I mean, you may have a favorite one of these to watch videos on, but I would encourage you to sign up for this webinar on all of them and even on both of these, because it helps drive traffic and we want to get this message out to more people. So just by merely signing up for us, whether you're that concerned about it or not, it's certainly helping the cause. So we certainly would love you to do so. But on that note, let's see where we are today. So I'm going to have Charles jump in here real quick and introduce David.
For sure, Jeff, and welcome, David. When writing the email going out Monday for this event, there's no shortage of provocative content to spur registrations and attendance. And I saw Jeffrey Tucker had tweeted that a year ago, and this is pretty much the COVID anniversary, he tweeted he was sitting in a bar in New York, and he was saying that there was this sense of morbid dread, as in his words, he knew the government was taking over, and every day got worse since. And shortly after that, this is a year ago in March, The Atlantic, pretty much a farm tool, said there are no libertarians in a pandemic, after which Jeff Tucker again published a book, Liberty or Lockdown. So he was one of the thought leaders in the movement who put his marker pretty much right up front early in the pandemic that liberty was more important. And then we saw the evidence of the corruption when all these heroic frontline doctors finding great efficacy with rather cheap therapeutics, hydroxychloroquine with zinc, budesonide, and even natural protocols, were persecuted. And the FDA, after issuing an emergency authorization for hydroxy, withdrew it. No shenanigans there. Then we saw these high-level epidemiologists from Stanford and Harvard and Oxford signing this great Barrington Declaration, along with one of Trump's advisors, Scott Atlas, saying, end the lockdown, shelter the old and the vulnerable, but pretty much this whole experiment with lockdowns is novel and not just justified by the science. And of course, that was ignored. The 40,000 now doctors and scientists that have signed that have been ignored and disparaged. And then we see all the fraud in the science, these PCR tests using cycles that guarantee finding some virus doesn't mean you're sick. And that has taken months for the CDC and the WHO to acknowledge, to get the states to stop testing with these excessive thresholds. And just recently, the CDC's own tests on masks showed, as Del Bigtree at Wire clarified by digging into the study, only a 1% improvement from masking and only a 1% increase in cases from reopening restaurants. That's not how the media spun it. The media spun it. CDC justifies masks. It's just such a crock this entire year of COVID hysteria and overreaction. And now we have the vaccine. Half the people in the country don't want it in the world. Half of the nurses don't want it in some institutions. The injuries, of course, are high, but of course, they're attributed to coincidence. Whereas PCR testing is making dead people dying of COVID, even if there is a tenuous connection with their comorbid cause. AstraZeneca has been banned in several European states, but it's had less deaths and injuries than Pfizer. And Pfizer is still legal. And now we have passports that are going to prohibit work, flying, learning, traveling, daily living for anyone who doesn't follow the dominant pharma paradigm on shots. Freedom from that mandate was defeated in Virginia, my state. We might need a national exemption, which I'll be discussing with another client of mine, National Health Federation, this Friday. Anyone who wants to discuss that, I'm in talks with folks on the Hill about what we can do. Things are bad, and a lot of libertarians have been weak in attacking the corruption at the pharma-dominated public health agencies. And David Weiner is a actuary. He's written about this and the vaccine corruption for years over at Lou Rockwell, at Age of Autism. And with that, Jeff, I'll stop and turn it over to David.
All right, David, I'm going to actually allow you to, oh, and by the way, you also write to the Age of Autism, just to add one more to the log to the fire. I'm going to stop sharing here, David, give you control of the screen again.
All right, well, thanks for the introduction and for inviting me on. I am going to talk about COVID quite a bit, but my presentation's a little bit more general than that. I'm going to speak to why libertarians should care about health freedom. And I think,
David, real quick before you get started, you might want to run it as the slideshow instead of like this split screen look. See at the top where it says slideshow, yeah, and then go from the beginning all the way to the left there. You'll see, yeah.
Okay, is that better?
Yeah, perfect.
All right,
now
cool.
Now it's full screen.
Thank you. Okay. We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness. What is at stake with health freedom? Nothing less than life, liberty, and the pursuit of happiness. A sweeping claim, but one that I intend to show is well justified. So this is an overview for my remarks today. Life, health freedom can often make the difference between life and death. Liberty, lack of health freedom is a threat to all of our liberties. The pursuit of happiness and COVID tyranny. And then I'll conclude with some remarks about why libertarians are needed in the fight for health freedom. Why do we need health freedom? I'll start with a quote from Hunter Lewis from his book, Crony Capitalism in America, where he says, "At any given time, nobody really knows what healthcare is or should be. Markets do not just provide goods or services. Before they do that, they first define what these goods and services will be. Then, having arrived at some definition of them, they must keep changing the definition in response to consumer preferences and signals. In a market system, consumers over time have the final say about how to define and continually redefine the product through their purchase decisions. But health freedom is also necessary for working out the business side of the equation. And I offer a few examples here. The level and type of education of those performing different functions, the financing, self-pay versus pooled, fee-for-service versus fixed cost, location, hospital, doctor's office, pharmacy clinic, telemedicine, and prices. How should goods and services be priced? So there seem to be a lot of good reasons for us to have health freedom. But something has gone wrong. The Declaration asserts our right to life, but the freedom of doctors and patients have been severely restricted to the point that terminal patients, can't even access potentially life-saving therapies if they haven't gone through the FDA gauntlet. And, they have to essentially plead for their lives under a right to try law. So what has gone wrong? Now, our understanding of history is really crucial here, and our misconceptions and gaps in knowledge must be overcome if we want to understand the present. Now, this is a very big topic, and many books have been written on these subjects. So today I'll just touch briefly upon a few of the key developments which have a bearing on this issue. What some of these developments are: the licensing of healthcare professionals and medical schools, licensing of drugs and medical equipment, the FDA, the burgeoning public health apparatus, and the government insurance programs. Okay, what about medical licensing? In 19th century America, there was a near free market in healthcare, with little in the way of medical licensing. There was a diverse array of healers, medical doctors, herbalists, homeopaths, and so forth. And compared to Europe, the quality of care was better and its cost was lower. Now, according to the standard history textbooks, some of the medical schools were inadequate and needed to either be upgraded or shut down in order to protect patients and avoid quackery. But the reality is that patients then, like today, preferred to have a choice about the type of practitioner that they relied upon. The impetus for medical licensing came from certain philanthropists, in quotes, Carnegie and Rockefeller, and the AMA, who wanted to institute a coercive legal monopoly to make allopathic medicine more lucrative for themselves. Medical licensing served not only to reduce the supply of doctors, but their diversity. The AMA, FDA, and the medical licensing boards use their power to squelch ideas and practices which pose an economic threat to incumbents. Medical licensing is used as a weapon, and it is the original sin of our medical system. Restrictions on medical options have been particularly onerous when it comes to treating cancer. This has made cancer treatment much more expensive and less effective than it otherwise would be. Some patients even travel to other countries to obtain treatments unavailable in the US. Now, cancer kills about 600,000 people each year in the US. In the appendix to this presentation, I have compiled a list of several good documentaries on this topic, which can be watched on YouTube. But suffice it to say that medical tyranny is not a new phenomenon, or unfortunately. Okay, what about public health? In the 20th century, we saw an explosion of state and federal activity in a variety of areas. And what we've noticed recently is that public health has turned into a sort of a trump card. And basically, whenever people complain about what the health department or one of the agencies is doing, all the politicians have to say is, oh, but it's a matter of public health, and we're expected to stop at that and go along with it. It really kind of in much the same way, that they'll call something an issue of national security, and that's supposed to be the end of the discussion. While measures such as improved sanitation, hygiene, nutrition, and reduced overcrowding did play major roles in reducing mortality from infectious disease, vaccines played at most a minor role. The notion that vaccines were indispensable here is nothing more than a big lie. Results of a 2000 study published in the journal Pediatrics found that 90% of the declines in infectious disease mortality during the 20th century among US children occurred before 1940, when few antibiotics or vaccines were available. As Thomas Sowell said, some things are believed because they are demonstratively true, but many other things are believed simply because they have been asserted repeatedly. Okay, now we'll move on to the section related to liberty. And here, my focus is going to be on vaccines, as that has become a major battleground for the health freedom movement in recent decades. And I'll ask a few questions, just to think about a little bit, and then I'll come back to them in a couple of minutes. Are you pro-vaccine or anti-vaccine? Okay. Are you pro-CT scan or anti-CT scan? Are you pro-insulin or anti-insulin? All right, we'll come back to that question in a couple of minutes. Here's a quote by Hermann Göring, who made this statement during the Nuremberg trials. Naturally, the common people don't want war, neither in Russia, nor in England, nor in America, nor for that matter in Germany. That is understood. But the people can always be brought to the bidding of the leaders. That is easy. All you have to do is tell them that they are being attacked and denounce the pacifists for lack of patriotism and exposing the country to danger. It works the same way in every country. Those who don't subscribe to the dictates of the CDC to one degree or another have been cast as the pacifists in the government's war on microbes, who are putting the country in danger. And it's a divide and conquer strategy, plain and simple. And it's a relatively recent phenomenon too, because not too long ago, people kind of made their own decisions about vaccination and didn't really worry too much about whether others were vaccinated or not. And I'll make one other comment here, that it occurred to me that the association between the connection that I'm making here ties in with the topic that Charles brought up earlier. The whole question of, are there libertarians in an epidemic? And that too was kind of a war metaphor. Okay. I imagine that when I asked you whether you were, pro CT scan or anti CT scan and so on and so forth, that probably sounded pretty strange, because we don't really stake our identity on our opinions of different types of medical technology. But somehow we hear the terms, pro-vaccine and anti-vaccine thrown around, that now it almost seems like, a valid concept. And I think everybody knows that the language that we use and the way that we frame our position is critical when it comes to politics. And the real point here is the debate should not be about whether we are pro-vaccine or anti-vaccine. That's a red herring. What should it be about? We should be arguing about whether or not it is really a good idea to have a government vaccine program. So now I'm going to talk a little bit about how the government vaccine program operates. It uses coercion, mandates. It makes decisions based on inadequate and poor quality research. Vaccines are promoted using misinformation and fear mongering. Legal liability has been removed. It utilizes vaccine schedules, which are really an exercise in central planning. And it constitutes a crony capitalist dream. So taken together, these elements violate the libertarian standards of informed consent and free markets. And libertarians should oppose the government vaccine program. I'll say a few more words about the one element, the crony capitalist dream, in terms of how that plays out. So government funds vaccine development. Government grants licenses to vaccine manufacturers, which allow them to sell vaccines on their schedules. Governments grant patents on these products, enabling manufacturers to charge monopoly prices. And then when combined with vaccine mandates, state promotion of vaccines, and lack of liability, these measures have made it highly lucrative for the vaccine manufacturers to promote the rapid expansion of the vaccine schedules. As an example, in 1983, the schedule prescribed 10 vaccines by age 5, and by 2017, the schedule had ballooned to 38 vaccines by age 5. The lack of liability took place from 1986 law. Still, the vaccine manufacturers are not content with their market. They are intent upon bringing extensive mandates to the adult population. And the problems really go beyond violations of libertarian principles. The observed health deterioration in recent decades is very troubling. In the interest of time, I'm not going to cover this slide. These are some points from a report called The Sickest Generation by the Children's Health Defense from the executive summary. But I have put a link to this report in the appendix. So if anybody wants to, dig in further, I'll make that available, and you can learn more about it. So far I've talked mostly about the program in general, but I'd like to go over a couple of specifics related to two of the viruses which have had a big impact on kind of where we're at today. And the first one is polio. And the point that the standard history tells us that the vaccine was the salvation against an ominous threat. But, several things have gone down the memory hole relative to polio. And the one I'll mention just now is that there was a high-dose vitamin C cure that was ignored and forgotten. In 1949, Dr. Frederick Klenner purchased a peer-reviewed paper showing that high doses of vitamin C could successfully treat polio. And this was 6 years before the vaccine was available in the US. And let's talk about measles too, because the view of measles has changed quite a bit. Before the immediately before the measles vaccine came out, there was debate about whether it was really even necessary, because it was recognized that virtually everyone who was well nourished, who got the measles, overcame it, just fine. Um, Fast forward to 2014, and there's complete hysteria surrounding Disneyland outbreak, to the point where no rational discussion was allowed, and essentially the Goring strategy was invoked, where the unvaccinated were blamed and supposedly putting everybody in danger. And this is really unfortunate, because according to the respected international researchers at the Cochrane collaboration, a meta-analysis of 60 measles studies found that data was insufficient to prove that the vaccine causes less death or permanent injury than measles. So, these politicians have a lot of chutzpah, to be, berating people for not taking the MMR, when it has never really been demonstrated to be protective. And of course, they never discuss the opportunity cost imposed by removing the natural viruses from circulation. Um, 1 second. A study from 2015 in the journal Atherosclerosis found that men had 29% fewer heart attacks and 17% fewer strokes if they had a history of childhood measles and mumps. So, you have to really wonder whether it's a good idea to, try to prevent a disease that almost, or I should say, an infection that almost everybody can overcome, and in the process exposing ourselves to some of the biggest threats, health threats around, that kill hundreds of thousands of people every year. Well, what was the fallout of all this? Exemptions were removed in certain states, and unvaccinated kids were kicked out of public and private schools. But even worse than that, the public acceptance of this draconian response paved the way for COVID tyranny. Okay. But it's my contention that the government vaccine program threatens all of our liberties. And I originally set forth this argument in a 2015 article for LouRockwell.com. So I'm going to walk through the reasoning I set out at that time. Free societies require multiple sources of authority and supports, such as the individual, the family, church, or mutual aid. And these are all undermined by the program, as self-ownership is denied, parental rights are violated, religious beliefs, matters of conscience are overridden. The program imposes a sort of forced collectivism. We're not individuals anymore. We're all just members of the herd, and, dangers to everybody else. The program enriches and empowers crony businesses, creating a vicious cycle of intervention. And it fosters public support for regimentation and central planning, because, without that, we might all just be dead or suffering from debilitating illnesses. So that, that fosters loyalty and even gratitude toward the state. So when you take all these together, these phenomena transfer power from civil society to the state, a process which could ultimately usher in the totalitarian state. Okay, now let's take a look at the pursuit of happiness and COVID tyranny. Now, COVID tyranny has imposed a massive assault on our pursuit of happiness. And I'm just going to kind of go through this list fairly quickly, because I think everybody has been living through all this, and it's not really going to be news that suicides, anxiety, and depression are way up. Isolation of elders, unrelenting fear campaign, unemployment, destruction of small business, restrictions on travel, remote learning, restrictions on entertainment, gyms closed, churches closed, and general restrictions on assembly. The silver lining, more people, libertarians included, are paying attention and recognizing that we cannot take the pandemic response on face value. For those who were paying attention previously, history is repeating itself in many respects. And I'll go through most of these fairly quickly. I think Charles did a good job of talking through them already. The exaggerated threat, the Ferguson model, the suppression of effective treatments, the downplaying of prevention measures, manipulation in the number of cases diagnosed up and down, manipulation of the causes of death assigned, implementation of arbitrary and unsupported measures, censorship, deplatforming of critics, foundations such as Rockefeller and Gates as promoters. Vaccine manufacturers demand immunity from liability. Mandates for government and insurance plans to cover cost of vaccines, subsidy. And then before I get to the next couple, it's clear that the actions taken have nothing to do with protecting people. Quite the contrary. But how do we make sense of this? Well, one thing is, from the beginning, we kept hearing that we need a vaccine to find our way out of that, and that seemed kind of strange. It's like it was a foregone conclusion. How did they know that? But I think really the only way to make sense of much of this is to see the COVID response as a Trojan horse for bringing in mandatory adult vaccination. And I would say it's also a COVID response. The COVID response is a Trojan horse for the broader diabolical Great Reset agenda. Now to get to the question, are there libertarians in an epidemic? And my take on this is yes, there are, but the results are mixed. Some have been very outspoken and unyielding in their criticism of restrictive measures. And others have been quite disappointing, quite frankly. And here are some reasons that I think that may be the case. They defer to establishment scientists, doctors. They consider the public health a legitimate government function. They have gaps in their knowledge of vaccine history and the modus operandi of the medical cartel. They fear that there will be repercussions if they speak out. And they support discrimination against the unvaccinated based on the principle that the owners of private property have the right to impose such rules. The last one is a very contentious issue and one where I disagree with, and I'm going to talk a little bit more about that next. Okay, private property rights properly understood. The right of owners of private property to be able to use their property as they see fit, as long as they do not commit acts of aggression, is a bedrock principle of liberty. So I'm not here to dispute that. However, in the modern world, where there's often significant overlap between the public and private spheres, this principle is invoked in situations where it does not apply. And here are some examples. What if hospitals are imposing a flu shot mandate in order to optimize their Medicare reimbursement? What if the demand for discrimination has been wholly manufactured by a state propaganda campaign? What if private vaccine mandates would be uneconomical if the businesses making these demands were subject to liability? What if the private business taking such actions is beholden to the government for bailouts or fears state retribution? And then, there are some cases where the state has simply imposed its rules upon private parties, such as California's SB 277, where vaccines were mandated for private schools. But I would conclude here, by saying, well, let's imagine that there's a case where the discrimination imposed is, in fact, a valid expression of private property rights. Here, libertarian principles only tell us that no valid crime has been committed. Still, it may well be that the action taken should still be considered reprehensible or unwise. Okay, my final section is why libertarians are needed in the fight for health freedom. And we've seen that they should care because it's a crucial foundation for all of our liberties. But libertarians can also make valuable contributions to this battle, since we can draw upon sound, consistent moral principles, a wealth of excellent scholarship, and our experience with government intervention. We know how that goes. And in this light, I will conclude with some of the things we need to do, both in the near term and on a long-term basis. Near term, we need to establish universal vaccine exemptions and eliminate emergency measures. And I think that much is clear, so I'm not going to say anything more. But we also need to think about the long-term solution for vaccine tyranny and promote a positive vision. And I originally set out to do this in a 2018 article for the website Age of Autism. And here's what I proposed. A complete separation of vaccines and states to end the government monopoly, and in its place to establish a free market for the means of protection against harm from infection. We need to allow people to rely upon trustworthy private organizations and individuals for advice about whether or not to prevent infection, how to prevent infection, and how best to ensure that no long-term harm arises. Some possible approaches that people might take under these circumstances: reliance upon nutrition, supplements, and herbs, use of homeoprophylaxis, the homeopathic counterpart to vaccination, use of vaccines, provided that informed consent and appropriate liability rules are operative. And with freedom, it's likely that many other promising options will come to light over time. I started out my remarks with a quote from the preamble to the Declaration of Independence, and I'm going to conclude with another quote from the end of the Declaration. We pledge to each other our lives, our fortunes, and our sacred honor. Forced sacrifice is unnecessary and counterproductive. However, voluntary sacrifice is needed for us to retain and expand our freedom. Each individual will need to decide what form this sacrifice takes. Our lives. Hopefully, we will not need to put our lives on the line, though we will need to give of our time. Our fortunes. Some may not be willing or able to put their career at risk, but they can still provide financial support to organizations that are successfully fighting for our health freedom. We can also choose to support businesses that respect our liberty. Our sacred honor. We need to speak out against medical tyranny, even if it means that some people will disrespect us for doing so. At the very least, we should never voice support for initiatives which threaten our health freedom, for example, Operation Warp Speed or vaccine passports. And that concludes my remarks.
David, that was very good. Needless to say, that's spawning a couple of questions for sure. So I'm going to jump right into that. And I see David's had his hand up for a little bit.
Thank you, Jeff. Dave, do you think healthcare freedom will be achieved through legislative solutions or free market solutions that actually make lives better for people and set the stage for later political solutions?
Yeah, that's a great question. I think it's probably a matter of both. And one thing that I didn't get to cover just due to time constraints is I think that there have been some important successes that have come about through markets and through activities, such as the legalization of cannabis and the primary direct care and other initiatives such as like the competitive pricing in surgery from the surgery center of Oklahoma. So I think it's a combination of both. We need to drive this thing through innovations, but at the same time, sometimes we need laws to allow these innovations to take place. Like with the legalization of cannabis, and for allowing direct primary care to operate, and the more that we can get support for these types of things, the better the chances are that we'll be successful.
Very good. Devin Young, I see your hands up. You have to unmute yourself there. No, in the interim, let's have Brittany jump in.
Hi, David. I'm sure you probably agree with me about this, but I'd just like to hear your thoughts. To me, it seems that on a lot of fronts, what we've seen the past year especially is the power of licensing to really control people. It's been sort of at the root of what's controlled businesses, what's sort of forced them to go along with a lot of these illegal mandates. And it's also been used as a tool of control with doctors. Dr. Paul Thomas is a great example, who his license was suspended 5 days after he came out with his vaxxed versus unvaxxed study. So do you think that, do you think we really need to be going after the institution of licensing itself? And if so, how would we do that?
Yeah, that's a great question, and that's something which has been something I've tried to emphasize too. on the topic, because there's really there's a lot of misunderstanding about it, and you know, people think that medical licensing is there to protect them, and you know, and to be fair, occasionally, you know, a doctor will lose his license because you know he's an alcoholic and he sawed off the wrong leg on somebody, and you know that's not the type of person we want to be practicing. But you know, so if that's the only thing that these licensing boards were doing, then you know we could tolerate it. But yeah, unfortunately, they're doing many other things which are actually harmful to patients, like the case in you know, Paul Thomas's case, or Andrew Wakefield, and many others. And you know, sometimes it's you know, the punishments themselves. Sometimes it's just fear that if a doctor steps out of line, they'll open themselves up to that type of activity. So it really places a big damper on innovation and the ability to kind of do what a doctor thinks is best, and that's really what we need, is we need doctors and other practitioners to be able to practice in the way they see fit. I don't know. I don't know how we're going to overcome that. I think libertarians recognize problems with licensing. They're probably one of the few groups that really do. But I think for a lot of libertarians, you know, they think it's more just a matter of you know, that licensing is a chance for the government to, you know, make money, and to restrict the number of doctors or other professionals, and that much is true, but they don't really recognize how big of an impact it has in a qualitative sense, in terms of, you know, that medicine has developed in a certain way because you know, doctors were restricted in the way that they can practice. So I think, you know, we really need to do a better job of conveying that message, to let people know that, you know, people are dying. Large numbers of people are dying, and they're not, you know, recovering from their illnesses because we don't have health freedom. And if we want to have health freedom, then we need to do away with the licensing.
Here you go. Ralph, I see your hand was up. You have to unmute yourself there. Ralph, are you there? Well, let's jump before let's get Jim in here real quick.
Okay, can you hear me?
I can hear you great.
Great presentation. Thank you. We need a lot more people like you. My thought was back to licensing, and you know, about 10 years ago, well, 2009 through 2011, there were a lot of articles that came out, The Bitter Pill in Time and Newsweek, why almost everything you hear about medicine is wrong, you know, with major studies that were peer reviewed, showing that, I think it was Dr. John Ioannidis, if I got his name right, that, basically up to half of all of the medical science is wrong. I mean, period. So to me, it was mind blowing that just kind of went away, you know.
Yeah, you can take a look at Eastern.
That went away, and I'm wondering, you know, maybe we want your thoughts on this, somehow get back to that, so people understand this is the battlefield medicine. I mean, it's great for emergencies, acute situations, but it's not healthcare. You know, we call it sick care, disease care. So it's a lie just to say, oh, this is good for everything. And that goes back to licensing. Maybe it's okay, you're licensed for acute care. Now let's look for people that can deal with health. I don't know. What are your thoughts?
Yeah, that's a great question. I think that, you know, that that licensing is really tied into these errors. You know, to err is human, so we know that doctors are going to make mistakes, but I think the problem is that they take such a long time to correct their mistakes. So, and I think that has to do with just the lack of medical freedom, and the fact that, you know, doctors can't speak out. You know, they can't criticize vaccines, for instance, without, you know, getting slandered and, you know, worrying about losing their licenses. So, so that type of regimentation, I think, really does not allow for these errors to be corrected in a timely manner.
Dave, we're going to jump into the fast response category. We're running out of time, but we've still got some hands up. So if you would, and I'm going to take a shot again, and I'm hoping I'm pronouncing this right. Davignon, his iPhone, it says.
Yes.
There you go.
All right. Reinsurance firms pick up the tab from insurance companies' miscalculations on man-made and natural disasters, and they're getting more so that they're doing campaigns like with the French to cut back their wine drinking so they don't smash into telephone poles. Reinsurance.co has 1,348 reinsurers on there. Most people don't know insurance companies pay 30% to 50% of your retail tab to a reinsurance company to cover their tail, particularly in a regional disaster. But they're getting more and more concerned about such things as floods and fires wiping out houses. And they're asking, can't we have fireproof and waterproof homes? So the same thing goes if tyranny is unprofitable, and I'm with percentages, you earn mutual medical finance insurance and are looking for actuaries who can see the forest for the trees as you do. Have you explored following the money here of pointing out to reinsurers the losses from these kinds of mistakes where seniors have to take a zoster vaccine, which would be unnecessary if the wild type varicella virus was let go in kids and they were exposed to their grandkids and got booster immunity that way. But the big pharma people get bucks off of promoting zoster at pharmacies. Have you explored anything with reinsurance firms?
No, I haven't, although I've given some thought to how insurance operates, and I know we're kind of running out of time, so I'll just kind of make it brief. You know, I think we don't have real insurance in healthcare, pretty much for various reasons, and the insurance companies, you know, are benefiting from these runaway costs. And really, if we had real insurance and competitive insurance, then they would be finding ways to keep our costs down, and that we need health freedom for insurance too, so that different types of companies can operate. And for example, I actually wrote an article about this. A company should be able to operate where, you know, it's can decide to support, you know, the more cost-effective type approaches to treating certain illnesses, and, you know, keeping the costs down that way, you know, for people who believe in that type of approach.
Very good. David, I see your hands up.
Dave, is civil disobedience an option to speed free market and political solutions, like refusing mandatory vaccines or violating public bans?
Yeah, I think that's pretty important here, actually, that you know, we can't tolerate you know, the things that are happening now, and you know, things have gotten pretty much out of hand, and you know, we need to push back more. And I know some people are doing that, but I think we need a lot more of that.
And that's a tough one right there to make happen. Jared, I see your hand up there.
Yeah. Thanks so much, Jared Wallen, urologic surgeon. I think that just a comment. As far as the licensing goes, it's certainly a huge problem. I would probably suggest that taking it one step further and saying that the fact that 500,000 or half of the physicians and counting are employed and essentially owned and silenced by big corporations is also a huge problem. I could certainly speak to that specifically myself. I've had patients where I had them asleep on the operating room table for 30 minutes and didn't have the proper instruments for routine procedures because the hospital just couldn't, they were just negligent in their practices. So, and that's just one example, but, obviously, again, you speak out against that and raise safety concerns, and the next thing you know, you're in HR as the problem. So that's a huge issue too.
Yeah, thank you. That's yeah, I know that's been a trend that the small independent practices have been there's been a lot of pressure, and a lot of them have gone out of business, and and that's problematic because if you're not on your own, that makes it harder to kind of operate in the way you see fit.
Dr. Singleton, I was going to say maybe you can speak on that topic for one quick second here, since you've been a party to some of that.
Thank you very much for the talk. I just find the whole licensing thing interesting in that, yes, you need to weed out people, but we're finding that licensing doesn't seem to be the way to do it. The problem is when people say, let the free market decide, what happens if you have a doctor who is a bad doctor, but 3, 4, 5 people have to die before you find that out? And again, licensing may not be the perfect way, but trying to find that way where you just can't say, when we find on social media, Dr. Smith kills people. And it's tough. As an anesthesiologist, one of the questions that patients would ask, and we had a standard answer, they'd say, oh, is Dr. So-and-so any good? Is he a good surgeon? And you're thinking, well, he's not the greatest. And then you say, well, I don't work with him much. And that was about all you could say, because here the patient is ready to go on the slab and you say, oh, I don't think their surgeon's very good. So you're really in a bind in that regard. So it's tough. I'm glad you're addressing it. What can I say? I wish I had an answer.
Yeah, thank you. People are always afraid of kind of the unknown, and that's the problem, or the difficulty with promoting liberty, is people can kind of conjure up all kinds of bad scenarios if you have, if you're suggesting freedom. But we know that there are other ways of addressing these concerns. We know that hospitals aren't going to just hire people who have no experience or expertise to do surgery and so forth. And we know that there's a lot of ways that we can find out about people's, their performance, and their track record and so forth. And more generally, you know, if there's a demand for that type of information, then the free market will supply it. But, you know, there's the reality is that there's no perfect solution. And, you know, even if we had a free market tomorrow, you know, it may happen from time to time that somebody unqualified causes harm, but we know that the current framework is not doing what we think it ought to do. And, you know, the free market would just do a lot better.
Very good. We got a good question from Rich Chalone. Are you there? Go ahead, Gil, please.
Well, I just, as a libertarian, it's a weird thing about, you know, is the pharmaceutical industry free to advertise on our so-called free press because they've essentially co-opted it? And New Zealand's the only other country in the world that allows direct-to-consumer advertising of drugs and vaccines. And it seems like, you know, now the press essentially is just a PR, you know, firm for pharma. So can you address that from the libertarian perspective? Because I think that's a huge problem here, you know, with people being sort of coerced by false advertising, essentially masquerading as news about the vaccines, all that misinformation and disinformation.
Yeah, that's a good question, and it's kind of a tough one from a libertarian standpoint, because it seems like, you know, they should be able to advertise, you know, as long as their information is accurate. But I think that it's really kind of a combination of different things. You know, if you take the freedom to advertise with the whole restrictions on medicine, so that basically, you know, medicine is, you know, so that allopathic medicine becomes dominant because, you know, other areas are not able to compete really on an equal footing. And then you know, you add in the patents and other measures which, you know, basically give the pharmaceutical industry, you know, outsized profits, basically. So in that context, it's really a big problem. I think if we had something closer to a free market, then, you know, it wouldn't be such a problem.
Okay, well, Dave, I hate to say this, we've zoomed past our time frame. That was great, and obviously you got some more hands still up, but we'll have to hold it for a rainy day, but more importantly, for the continuing the conversation section of the site. So again, first of the week, you'll see this. Definitely connect with Dave after. And Dave, thanks so much for being here today.
Well, thanks for having me on.